All right, so thanks again for doing this. First question that I have for you is tell the audience a little bit about yourself and how you got started in the disability community.
Yeah, so my name's Megan Ferris. I'm a doctor of physical therapy, as well as an orthopedic clinical specialist. I work at Valley Medical Center in the lifestyle medicine department, which I obviously work as physical therapy. My start in PT was my mom is actually a physical therapist. She worked at the VA hospital for about 30 years and specializes in amputee rehab. She's retired now, but I got started because I had a lot of experience going to work with her and getting to see what she did, which just really sparked my interest. And she had a lot of interest in doing kind of extracurricular activities. So she worked with the wheelchair games. She did a lot of ski for all excursions, which now it's outdoors for all. But she would go on a lot of those excursions and I got to go with her. So I got a really good look into adaptive athletics, adaptive sports, adaptive recreation, and that kind of just sparked my interest. So I went to PT school and graduated 10 years ago. So I've been working in the field for about 10 years now.
That's nice. I know Outdoors for All since I participated in that organization, so I'm familiar with that.
Yeah.
My next question is like tell me a little bit about the work that you do with patients in the PT realm. What's the day-to-day like?
So the clinic that I work in is lifestyle medicine. We try and take a little bit more holistic of an approach to physical therapy. So if you look at kind of different clinics you can go into, you've got kind of orthopedic, which is more your joint pains, work injuries, things like that, or your neuro clinics, which specialize more in like stroke rehab, spinal cord injury rehab, those sorts of neuromuscular uh, issues. And so I work in a orthopedic clinic. So we look at joint pains mostly, but we try and look a little bit more holistically. So instead of just thinking about the muscles and tendons and joints involved, like all the biomechanics, we tend to look like maybe they have high blood pressure or diabetes, and those things can affect your ability to heal, affect your ability to experience pain, and affect your healing process in general. So what we do is not just look at the structural components, but we look at the big picture. So I'm usually asking people about things like their sleep, their diet, their stress management, their general exercise routine, as well as like tobacco and alcohol usage, rather than just what hurts and where. So yeah, day to day, I'll be having conversations sometimes with people about motivational strategies and how to manage their stress, or we might spend 10 to 15 minutes talking about nutrition and getting enough protein. One of the cool things that we have in our clinic is we have dietitians on staff. We also have exercise specialists on staff. So when someone's coming in for, like a joint replacement surgery, we're having conversations about overall lifestyle rather than just the, exercises that you need to do in order to recover those muscles. So it's good. It's a little bit more holistic. It's a little bit more big picture, and we find that we're having a lot more success with treatment and managing those chronic kind of conditions, rather than just looking at here's some exercises that you have to do. I don't care if it hurts, just keep going, kind of a mentality.
Mm-hmm. My next question is, what sorts of methods or approaches do you use in your particular type of work?
Um, so I tend to really try and focus on what a person is capable of doing rather than what they're not capable of doing, because everyone does things differently. I have people in here who are after stroke or who have cerebral palsy. So just neuromuscularly, their bodies work a little bit differently than what you would kind of quote unquote consider normal. So it's really about figuring out what that person has available at their disposal and maximizing that efficiency. anybody is capable of exercising. You just have to find the right one for that person. So I usually will try and approach somebody and say like, okay, what can you do right now? What do you want to be able to do, but what can you do? And how can we get you there? Rather than focusing on all the negatives, like this muscle is not strong enough, or this joint doesn't move well enough. You can always maximize efficiency, but in order to create like a positive working environment, you want to focus on what someone's capable of doing rather than what they're not capable of doing.
Mm-hmm. Yeah, because everybody has different needs, and so it
Exactly.
needs to be tailored to their certain needs, I guess.
Yeah.
Uh,
Everyone needs exercise, everyone needs movement, but it looks different for every person. Even if they have the exact same structural anatomy as another person, they're going to have different, exercises they prefer, different things they enjoy. You just have to find what works right for that person and their body.
mm-hmm. My next question is, what impact does this kind of work have on not just yourself, but also on the greater community? Because you come from a physical therapist, not just background, but you have in your family, you have family members that were in the physical therapy realm. So could you talk a little bit about that?
Just the general impact on the community.
Yeah.
Yeah. I think especially since I started at lifestyle medicine, the impact that I'm hoping we have on the greater community is just creating accessibility to exercise and movement, and talking about the importance of general lifestyle factors on your capabilities. I think a lot of times people really want quick fixes for things, and unfortunately, that's not the case for everybody. It's not the case in general. We're capable of doing hard things. We just have to kind of set our minds to it. So my hope is that the effect that we have on the community is teaching them how to work with their bodies and work with their preferences and lifestyles to be the healthiest that they can be.
Mm-hmm. What have people said, like when people come to you and say, Megan, I need help with this, and this, what have they sort of said with like, when they come and seek your services or your help?
Sometimes you kind of get the whole spectrum. Sometimes you get people who come in here and say, I don't know why I'm here. My doctor just sent me. And then, you're kind of climbing from a hole, trying to get them and build that patient rapport and build a connection and build some trust with the person and explaining what my job is. And then you have people who come in here raring to go. They've said, I'm really struggling and I want guidance and I want help. So you can really kind of get the whole spectrum, and you never really know what you're going to get when you're walking up to meet a person for the first time. But whenever I ask people about things that they're struggling with outside of just their pain, you'd be shocked at how many people start crying. It's an emotional process, and some people haven't really fully processed that sort of stuff. So, sometimes that's the case where you're just sitting there, like letting a person let their feelings out and experience that, for the first time. They haven't really expressed that to anybody. So it can really go multiple different directions. So you never know what you're going to get, but usually I try by the very end of the session to just build a connection point with a person and kind of express to them that I'm in their corner rather than me just telling them what to do. I want to work with them rather than just saying, here, you need to do this. I don't care the consequences.
Yeah. My last question to kind of wrap this up is what can people take away from this conversation? How can physical therapy, improve people's lives? Because let me tell you, I have a friend who's in the physical therapy realm. She completed her master's in physical therapy.
Mhm.
So, what sorts of advice do you have for people like her who are on the path that you're on?
So specifically, mostly for people who are looking to go into physical therapy.
Yeah.
Yeah. The thing that I would really encourage them is to find the niche that they enjoy working with. Physical therapy is such a broad field. You can really specialize in a lot of different things. There's a lot of information out there, and really find what truly you're passionate about. When I first got into physical therapy, I thought I had it in my head that I was going to follow in my mom's footsteps and work at the VA and, do spinal cord injury rehab or amputee rehab or something, which I think is an incredible, incredible specialty. But my brain just wasn't organized that way to really specialize in that field. I found myself more drawn to the biomechanics of the joint. So you kind of have to let go of what maybe you originally thought you wanted, but find what speaks to you and what works for you.
Yeah, that's true.
Yeah.